I think of digital mental health as anything that's digitally supported. So that could be research that uses technological innovations. It could be research using wearables to look at people's sleeping patterns and how that might relate to psychosis and relapse, or how that might relate to the onset of depression. It could be research that uses smartphones to help people keep a diary of their mood over time. But it could also be wider than that. It could be interventions that are delivered through digital platforms and using technology. So it could be what some talk about as telehealth, where, you know, for example, Skype is used for consultations with a psychiatrist or a psychologist, where it's difficult to facilitate face-to-face contact. It's something that's being used in forensic settings, for example. Or it could be interventions that monitor patients in their sort of real life, real environment. So it helps them keep a diary again of their mood that a clinical team could monitor remotely. Particularly given that the journal is for practicing relatively young clinicians, psychologists, psychiatrists, and I think this is something that people are seeing in practice. I think, anecdotally, I know that a lot of people have patients who say, I've been using this mindfulness app, is it okay? And I think clinicians sort of want to know a bit more about it and maybe need some help in being guided, because there are thousands and hundreds of thousands of, for example, app-based interventions out there. The aim of the new section on digital mental health in EBMH is very much to generate discussion around digital mental health in the wider sense and to disseminate new findings. It's a very exciting area of clinical research and practice, and I think at the moment it doesn't yet quite have a home in an academic sort of journal sense. So we're very keen to attract contributions, but also for this to become a place where people can be guided in their practice and have some discussions around new innovations.